Heart disease can be influenced by what we eat. In each section, we will highlight specific foods and nutrients shown by research to benefit myocardial infarction survivors, patients with atrial fibrillation, and those with arterial plaque buildup. We will also explain the key nutrients or compounds in each food and how they support heart health, and any cautions if a patient is on common heart medications like blood thinners or statins that could interact. This guidance is based on scientific studies and medical sources. Myocardial infarction, or heart attack. Fatty fish like salmon, mackerel, and sardines are rich in omega-3 polyunsaturated fatty acids, specifically EPA and DHA. Omega-3 help reduce inflammation and stabilize heart membranes after a myocardial infarction, and they can modestly improve blood lipids and lower triglycerides. They are generally considered as heart protective, though their effects on atrial fibrillation prevention are less clear. A word of caution: fish oil supplements and high omega-3 intake can increase bleeding risk when combined with anticoagulant or antiplatelet drugs, such as warfarin or aspirin. Berries, such as blueberries, strawberries, and blackberries, are loaded with anthocyanins and other polyphenols, powerful antioxidants. Frequent berry consumption is linked to lower LDL, or bad cholesterol, and reduced oxidative stress in arteries. In animal models, berry extracts inhibit LDL oxidation and foam cell formation, slowing plaque buildup. Caution: there are no known serious drug interactions, but berry juice can be high in sugar, so it's recommended to eat whole berries or opt for homemade juice. Oats and barley. These whole grains contain soluble fiber, known as beta-glucan. Eating about 30 to 40 grams per day of oats or barley significantly lowers LDL cholesterol. This, in turn, can help reduce the risk of arterial plaque. Caution: there are no major interactions, but it's important to take oats as part of a balanced diet. And, avoid sweetened instant versions. Leafy greens like spinach, kale, and arugula are high in dietary nitrates and potassium. Beetroot is another food and one of the richest dietary sources of inorganic nitrates, which are converted in the body to nitric oxide, a compound that relaxes blood vessels, lowers blood pressure, and improves blood flow. Beetroot juice has been shown in clinical studies to lower systolic blood pressure by 410 mmHg within hours of ingestion, with regular intake sustaining benefits over time. Nitrates boost nitric oxide production, which relaxes blood vessels and lowers blood pressure. This vasodilation reduces the workload on the heart, which is especially useful for individuals with AF or arterial plaque, where vascular resistance plays a key role in disease progression. In one large study, people who ate the equivalent of about 1 cup of leafy greens or chopped beetroots daily had lower blood pressure and lower rates of heart disease. Greens also provide vitamin K, which is important for blood vessel health and fiber. However, if you are on warfarin, a vitamin K antagonist for atrial fibrillation or post-myocardial infarction, it's important to keep your vitamin K intake consistent. Beetroot is generally safe when consumed as part of a balanced diet. People on ACE inhibitors, ARBs, or potassium-sparing diuretics should monitor potassium intake, as beets are moderately high in potassium. If drinking beet juice regularly, be aware of its oxalate content. Those prone to kidney stones may need to limit intake. May cause harmless red or pink urine, stools, beta-urea, which should not be mistaken for blood. Also, sudden large changes in greens can alter warfarin effects, so keep intake to moderate. Nuts such as walnuts, almonds, and hazelnuts contain unsaturated fats, plant sterols, and fiber that improve cholesterol. Diets enriched with walnuts significantly reduce total and LDL cholesterol. Walnuts in particular reduced LDL by about 10 milligrams per deciliter on average. Caution: very high omega-3 nuts like walnuts have mild blood-thinning effects. If you're on anticoagulants, eat in moderation, about 5 walnuts per day, and monitor for bruising. Legumes, such as beans, lentils, and chickpeas, are high in soluble fiber and plant protein. Diets rich in legumes significantly lower total and LDL cholesterol. This occurs because fiber binds bile acids and helps excrete cholesterol. Caution: there are no major drug interactions, but legumes can cause gas, so it's best to introduce them gradually and use fennel or peppermint for garnish in order to combat gas and bloating. Turmeric, also known as curcumin, is a spice that contains a potent, anti-inflammatory antioxidant. Animal studies and a recent meta-analysis suggest that curcumin reduces infarct size and inflammation after heart injury. In lab studies, curcumin also blocks fibrosis and cell death in heart tissue. However, caution is needed. In high doses or supplements, curcumin can enhance the effect of blood thinners. There was a reported case where turmeric raised a patient's INR on warfarin into a dangerous range. Using turmeric as a spice is unlikely to cause problems, but patients on warfarin or antiplatelets should definitely discuss it with their doctor. Dark chocolate, with 70% cocoa or higher, is rich in flavonols that boost nitric oxide and improve vascular function. Dark chocolate significantly reduces blood pressure, especially in people with hypertension. For example, one pooled analysis showed a 3 to 5 millimeter mercury drop in systolic blood pressure with flavanol-rich cocoa. The antioxidants may also prevent LDL oxidation. Caution: choose unsweetened dark chocolate to limit sugar. No major drug interactions, but high intake has calories, so enjoy in moderation. Garlic, its active compound, allicin, has mild cholesterol-lowering and blood pressure-lowering effects. A comprehensive review of trials found garlic supplementation reduced total cholesterol by around 17 milligrams per deciliter and LDL by about 9 milligrams per deciliter in people with elevated cholesterol. Garlic also has antiplatelet properties. Caution: if on blood thinners like warfarin or aspirin, garlic can add to the bleeding effect. Patients should inform their doctor about high garlic intake. In normal dietary amounts, say a clove or two per day, garlic is generally safe and beneficial for heart health. Atrial fibrillation, often referred to as AF, is a condition that can be influenced by diet. Leafy greens and vegetables, much like in myocardial infarction, supply essential nutrients such as magnesium, potassium, and nitrates, which are beneficial for heart health. Magnesium, which is found in foods like spinach, Swiss chard, pumpkin seeds, and almonds, plays a crucial role in maintaining the electrical stability of the heart. Deficiencies in magnesium can promote arrhythmias. While high-dose magnesium hasn't shown clear prevention of AF in all studies, obtaining it from foods is a reasonable approach. Potassium, found in bananas, avocados, and beans, also helps maintain a normal rhythm and control blood pressure. However, if you are on warfarin, it's important to maintain a consistent vitamin K intake from foods like spinach and broccoli. Newer anticoagulants, known as DOACs, are not affected by vitamin K, but it's always best to check with your doctor. Berries are another excellent food choice for those concerned about AF. The antioxidants in berries help reduce inflammation and may protect the atria from remodeling, which is beneficial for maintaining heart health. A heart-healthy pattern, like the Mediterranean diet, high in fruits and berries, is linked to lower atrial fibrillation risk. For example, berries contain quercetin and other flavonoids thought to improve endothelial function and reduce stress on the heart. Caution: berries do not have known adverse drug interactions. Omega-3 foods, fatty fish again appear here. Observational studies once suggested fish intake might lower atrial fibrillation onset, but randomized trials did not confirm this yet. Still, omega-3 improve overall heart health by reducing atrial stretch and inflammation. Eating fatty fish a couple of times per week is reasonable. Caution: as mentioned previously, high-dose fish oil with warfarin can increase bleeding risk, though supplements in normal doses are often safe under supervision. Whole grains like oats and quinoa, along with legumes, are fiber-rich foods that help prevent obesity and high blood pressure, both of which are risk factors for atrial fibrillation. For instance, oat fiber can modestly lower cholesterol and improve blood vessel function. Whole grains and beans also provide magnesium. However, a word of caution: while there are no specific interactions, foods with moderate fiber can slow the absorption of some medicines. So it's best to take medications 1 to 2 hours apart from very high fiber meals. Nuts and seeds such as almonds, pistachios, flaxseed, and walnuts provide healthy fats, magnesium, and L-arginine, which helps produce nitric oxide. Walnuts' omega-3 ALA may support heart rate stability. Caution: as before, very high nut intake with anticoagulants can mildly increase bleed risk. No known issues with rate control drugs, like beta blockers or statins. Beetroot juice. While not exactly common, beet juice or beets are high in nitrates, much like leafy greens. Some small studies show nitrate-rich beet juice acutely lowers blood pressure, which can ease strain on the heart. Caution: beet juice is safe, but has no major scientific evidence in AF. High potassium in beets should be noted if the patient is on ACE inhibitors or ARBs, as it can raise potassium. Extra virgin olive oil, as found in the Mediterranean diet, is high in monounsaturated fats and polyphenols. It improves cholesterol balance and endothelial function. Incorporating olive oil in dressings or cooking supports overall heart health. And importantly, there are no drug interactions with olive oil. Although not a food, fermented beverages of alcoholic nature and salt can trigger AF episodes. These must be avoided at all times, especially important as they are well-known AF trigger. Arterial plaque, also known as atherosclerosis. Oats and barley, beta-glucan in oats slows plaque growth. Adding 3 to 4 grams per day, for example, oatmeal, can lower LDL by about 5 to 10%. This can translate into fewer plaque deposits over time. Nuts, especially walnuts, have plant sterols and omega-3 that directly lower LDL, as previously mentioned. The walnut meta-analysis showed significantly greater LDL drops on walnut-enriched diets in relation to arterial plaque condition. Regular nut consumption, like 1 to 2 ounces daily, is recommended by heart guidelines. But caution, as noted, be mindful of bleeding risk with warfarin at high intakes. Garlic. Again, garlic's cholesterol-lowering effect, with a 17 milligrams per deciliter total cholesterol drop, is clinically meaningful. Over months, this can slow atherosclerosis, but caution, same as above with blood thinners. Flaxseed is rich in soluble fiber and ALA omega-3. Meta-analysis shows that whole flaxseed, especially when ground, lowers total and LDL cholesterol and can directly influence resolution of arterial plaque. You can add ground flaxseed to cereals or smoothies. However, caution is needed. Flaxseed also has mild antiplatelet effects, so high doses with anticoagulants should be monitored. Avocados are full of monounsaturated fats, which support a healthy lipid profile and improve cholesterol balance, lowering LDL and raising HDL over time. Caution, no interactions. However, avocados are calorie-dense, so keep portions moderate for weight management. Red wine, when consumed in moderation, is rich in resveratrol, a potent antioxidant. Moderate red wine consumption, about 1 glass per day, improves endothelial function and supports healthy blood flow. It's important to note that consumption can worsen atrial fibrillation and myocardial infarction outcomes, so it should be avoided in these conditions. The information provided in this video is for educational purposes only and should not be considered medical advice. Like, share, and subscribe to our channel for more evidence-based knowledge. Don't forget to explore our playlists on various topics. Until next time, keep learning.